Children below the age of 12 could get their COVID-19 jabs early next year. Singapore is also looking at administering booster shots, with its expert committee on COVID-19 vaccination now finalising its recommendations. Tan Se-Hui with this report.
20,000 shots are administered daily at these vaccination centres. That's a drop from 80,000 at the peak of the vaccination exercise. The plan is to cut down the number of such centres, though some will be retained, to vaccinate groups such as children below the age of 12 from next year. These centres could also administer booster shots following a review by the expert committee. Booster shots are recommended 8 months from the second dose. But before that happens, two issues must be addressed.
First is the incidence of adverse reactions. Number two, should we go for the same vaccine or a different vaccine? And we call it a homologous or heterologous strategy. And there is scientific basis to suggest a heterologous strategy may confer stronger protection.
The task force says there may also be benefits in providing a third dose of the vaccine for those whose immunity is compromised, such as those undergoing cancer or transplant treatment. To free up healthcare capacity, the Health Ministry will also pilot home isolation for recovering COVID-19 patients who are fully vaccinated from 30th August. It's for those who have mild or no symptoms. They must self-isolate in a room with an ensuite bathroom for at least 14 days, undergo regular antigen rapid tests, and complete an exit PCR test. But these individuals need to first be assessed. They should not belong to or live with vulnerable groups like seniors or pregnant women. They must also be tagged for surveillance purposes.
We will put in place a robust monitoring and support system to make sure the individual stays at home and also receive adequate medical support. Family members, they are all required to be fully vaccinated and also quarantined at the same time. So if we want to live with COVID-19 as an endemic disease, this is a crucial step to take.
Authorities say the road ahead will not be easy. Even with high vaccination rates, Singapore will not reach herd immunity. So the country must be prepared for the number of cases and clusters to rise as it reopens.